And with that, I think we're good to go with questions.
We are trying to stay true to the 1 hour time limit, and I actually do have to step out here in a few minutes for another call, but let's go ahead and we'll hit the questions. If you've not entered a question, do so in the question box. Encryption was not a requirement for stage 1. What do you think the risk of not having it is in 2015? My opinion, probably a big risk because there are no call-outs specifically for encryption and stage 1 alternate exclusion or anything like that. I would strongly recommend, if you do not have encryption in place, that you at least within your security review, you call it out. You say right up front, we don't have encryption, but then you document what you've done to mitigate that risk. Some EHRs don't support encryption of their database, so you just have to find other means of mitigating that possible risk.
Yeah, and the encryption, what they're talking about, the main area that you're interested in is mobile devices. And don't forget that if you have encrypted, you get a get out of jail free card if you have a data breach. So you avoid some of the reporting requirements and public notice that goes with not having encryption. So that's really was a stage 2 requirement.
Next question is there a requirement for attribution for CDS? I didn't see it in the rule, but it was 1 o'clock in the morning when I got to that section. God love you, we were in the same boat. If by attribution you're meaning a call out to say that this CDS rule was recommended by the the American Health Association or whatever, those call outs are only appear in the EHR specification, in the certification criteria. The vendors are required to provide that attribution for the delivered CDS rules. Now, on the meaningful use side that's intended for the EPs and the hospitals, there is no such requirement. The CDS rules are a little more free-form, a little more open. They're really allowing the providers to focus on improving specific areas of care. It just doesn't exist.
Okay, the security risk analysis, does it need to be completed, or does the mitigation need to be completed by the time of attestation? Just the risk assessment itself, you have to document prioritize your risk and give a plan of action by date, but you do not have to have it fully mitigated.
A couple questions about a copy of the slideshow and our little cheat sheet.
They'll come out today.
Yep.
Cathy Rich is all ready to go along with the cheat sheet.
Does a MedRec apply to all encounters or just transitions of care?
It's supposed to be just transitions of care, which is considered to be a new patient or a patient that has been transitioned back to your practice from another location. So it may have been one of your patients that was hospitalized coming back into the practice, are the two technical areas that are considered transitions of care, but CMS specifically says in the rule that they consider it best practices to do MedRec on every single patient.
Okay, secure messaging. Does a clinical message sent to the patient portal meet this measure? Yes, it does if that message is sent to a specific patient. It can't be a blast. It can't be like the old reminders and whatnot. Those don't count. It has to be provider sending a message to a specific patient. Hey, how are you feeling after our appointment?
Or responding to their message to you, one or the other.
Does a secure message have to be clinically based, or can it be an administrative? It does technically have to be a clinical message. From a reporting standpoint, I don't know how you're going to, make that determination, but it just in the working rule is that yes, it should be clinical.
It can be stuff like refill of prescription. It can't be billing. It can't be, this is a reminder of an appointment you already have scheduled, but it can be, hey, we see that you need to have an A1C done. You're diabetic. This is reminding you to come in and get that drawn. That's different than saying, hey, you have an appointment next Tuesday at 9 o'clock.
As far as I know, immunization registry is the only active registry at ODH. So how do EPs get to 2 public health reporting objectives?
That is what we're recommending is to go in when you do your registration with the public health ODH, where you have to register to meet stage 2 criteria. check the box also for syndromic surveillance. As ODH has said, they do not have the bandwidth to actually go ahead and have all physicians report syndromic surveillance, so they'll set up their own internal priority schedule, and you may not get called for years, if at all, and at that time you'll be asked specifically by ODH whether you want to participate. But for meeting the measure this year, you can check that box. Okay, is PQRX registry included? No, they are not talking about the clinical data registries that were in the proposed rule have been removed, including the PQRS registries. We're talking strictly about registries that are maintained by the state of Ohio, by the Department of Health, or as I said, possibly the ORS database, but we don't know that yet. Can stage 1 EPs attest yes for syndromic surveillance if they are in the queue? Yes. Anybody can test for syndromic if they are in the queue. The measure for public health reporting, the way you meet it is the same as it was in stage 2. You get registered, so you're either registered and waiting to be contacted by ODH, waiting to work with the HIE, or actively in the build process, or actually transmitting. Those are all various ways that you can meet public health reporting measure. You do not actually have to be transmitting as the way to meet it. Yeah, you do not want to, I mean, you can take an exclusion for syndromic if you're a specialist that would not ever report syndromic, like a dermatologist or pathologist, something like that. If you're primary care or something, you would have the option of including that. Otherwise, you would take it as an exclusion. But if you take an exclusion, as you know, you have to show that nothing else is reportable by you. So in the physician area, syndromic, immunization, and specialty registries. And if you aren't doing any of those, you will take an exclusion for all three, but then you have to demonstrate or write, what I'd say is write a few sentences about why you believe you're excluded. Let's see. We'll get this PowerPoint, yes, today. We have encryption. It was just not assessed. Oh, as part of your public, or not public health, as part of your security review. You know, what I'd say, Carla, on that is, or I'm sorry, that's Jill. If you have encryption and it wasn't done as part of your privacy and security review, you haven't attested yet for either the hospital or the physicians. I would go back, and if you had an outside review, point that out that it's missing in that review. If you did an internal review, I'd have your internal people go back and make a note of it and talk about where is it data in transmission, data at rest, and what it covers. Okay, for the CPOE, if a scribe is licensed or credentialed healthcare provider, would they meet the measure? Yes. Can you list, it's not that scribes can never be used for CPOE, but if they're used for CPOE totally independent of the physician, then they have to meet under some other measure. So they have to be a certified medical assistant, they have to be a nurse, something like that. Can you list where in the final rule it defines jurisdiction as only state? You don't have to look at national registries. You know what I'll do is I'll put that in the cover email, but it talks about within the jurisdiction, and jurisdiction being defined as the state. So Sonia, I will give you the page site on that. I mean, we'll obviously send you a copy of the rule too, in case any of you haven't seen it. If a practice doesn't do immunization as registered their intent for syndromic, that will cover public health measures if you also show that you are excluded from having to do any specialized registry reporting. And in Ohio, the only other registry that I am aware of that ODH runs that falls into this area is the cancer registry, and even that is not fully up and running, but they do accept registration for that. So if you're not an oncologist who would normally be reporting that, you would be taking an exclusion for that. So yes, you would do syndromic take the exclusion for immunization, take the exclusion for specialized, but make sure you have a little brief narrative about why you feel you're excluded. Okay, regarding EP secure messaging, the provider generates a message to the patient. Does the patient have to open the email? No, you just need to show that it was transmitted and not that it was read. CPO, define what you mean by scribe. Scribe is, I can't say it's actually defined in the reg, but there's such a long discussion on it. Again, I'll point to the paragraph where they talk about that, but it's basically any person who follows the provider around and enters information that the provider otherwise would be entering themselves to allow the provider to concentrate on their examination. The problem with scribes, and this is why I think CMS discussed it, is that they may be extremely good, may be very bright, but they might not have additional training to respond to alerts and stuff. And so that is why CMS says the scribe as a category is not covered, because a scribe could be anyone from, just someone that you've trained off the street to a PhD. And what their training is will determine whether or not they can independently enter medication orders and have it count. So you see what I'm getting at? It's not that scribes themselves are forbidden, but if you're using a scribe, you have to make sure that they're credentialed in a way that covers you both legally and within the terms of the rule. So I think we're at the end of the questions and the end of the hour, and so we will get this out to you. We'll probably even have it out this morning. I think that everything's ready to go, and we are doing this again on Monday and Wednesday. So if you have other people who need to listen, feel free to have them register. And thank you so much, and everyone have a great weekend. Talk to you all soon. Bye.